Denver, and Dr. Paddy is a pediatric dental office. I just did a tour of your office, and it's pretty amazing.
Thanks.
So yeah, thanks for that tour. So how long have you used Waterlase?
So about 10 years now. Yeah.
Okay, and
So-
what do you use it for here?
So we use it for gingivectomies, uncovering teeth.
Mm-hmm.
Just the other day, we had had a patient that was like 9 and 2 front teeth just wouldn't come in.
Right.
They're trying. They had been knocked out a long time ago and uncovered them and had 2 front teeth. So it was pretty good. And frenectomies, lingual, anterior mandibular. We even do posterior, and then like even the side frenum sometimes.
Okay, you do that as well.
And then the maxillary anterior frenum. The most common is that. With the tongue, would be generally the speech. The big ones are like the S's and L's. So they have like a lisp or something like that. So
Yeah, it really helps their speech.
yeah, we've had lots of patients like and then we have we'll send them to speech therapy and stuff like that. But as I always say, you can run a marathon with a sprained ankle, but it's much easier not to have a sprained ankle.
That makes a lot of sense.
So you might as well give them every advantage to maximize it.
So as a pediatric dentist, without the Waterlase, would you be doing a frenectomy?
No, I just wouldn't do it. Yeah.
How do your patients feel about the laser?
They love it. I mean, and then we'll tend to, if sometimes we'll even fix ones that were done really little and with the scalpel that creates that scar tissue, we'll remove the scar tissue and then make it all nice and fancy.
The main use is around soft tissue.
Yeah, mainly soft tissue. But I've done tons of, patients that had braces, and they basically had inflammatory response for 2.5 years, and that gum is not going down.
Right.
And you do a gingivectomy, and it looks beautiful. So
Wow,
they're very happy.
How easy was it to get your staff involved in this? How was that transformation?
It was pretty easy, honestly, for me, because I had a couple staff members kind of have traveled with me. So it's pretty seamless, to be honest, on my end. But I mean, I could see, if they just don't know what it is, but I'll just bring in the new staff and be like, hey, before, after, and they're like, wow, that's cool. And actually, I've even done it. I have done some laser pulpotomies, which I've started to do, and I just used it on a surgical case where I basically we had to lay a flap. So we had to take out some teeth, and we had to lay a flap, and then I took down the bone with it and reshaped the bone with the laser, and then sutured it back up.
It seems like you're using it for a lot of different things.
So we have 2. And we keep one in the surgical suite, and then one we kind of move that one around and keep the other one in the surgical suite. And we just got 2 I+s for our other doctors.
Okay.
And they're super happy. They just sent me a text message of a case.
Excellent. Well, what I say, in fact, I think it's on my LinkedIn page. One of my goals in life is to raise a generation of kids not afraid to go into the dentist.
Right.
So thank you for helping out
Hey,
with that.
no problem.
Appreciate it.